So I'll stress the flu shot. There's also, people are hearing, flu shots during COVID. Why is that important? I think the other reason is that we don't want the hospitals and doctors' offices just to get overwhelmed with people who are coming in for flu during COVID season in case those COVID numbers start to go up again. But it's a really simple and really effective way to prevent yourself from getting sick. There's some reports, kind of conflicting reports, on whether a flu vaccine also helps prevent COVID. I did see one series of reports that suggested it might actually. I know that early on in the pandemic, people thought it was the opposite. But certainly it, if anything, it's probably beneficial and certainly doesn't seem to be harmful in terms of COVID. I'm delighted to say that most of my patients here at the Center for Senior Health, when they come in for visits, basically tell me how careful they've been. That they have been mostly staying home, that they're very careful when they go out. They're limiting their contacts with sort of friends and family to these safer environments. The one exception to that is I have heard a few stories of people who have gone to religious services in their faith communities. And in most cases, those are potentially places where people unfortunately will get sick. And I know that it is no fun to go to a church or synagogue or other religious observances on Zoom, but it's way safer. And in particular, some of the biggest outbreaks we've seen to date around the country and around the world involve people at church singing together, because when we sing, when we talk loudly, we tend to spread virus more, unfortunately. So I would just encourage people to find ways to practice their faith and to join in community in ways that still involve masking and physical distancing. But otherwise, like I said, my patients are mostly telling me that they've been staying home, they've been staying careful. I've had very, very few patients get sick, which is such a relief. And I think I'll just stop my comments there and see if there are questions. And Amelia, feel free to call out if there are particular questions in the chat. I don't know that I saw, I haven't been monitoring the chat. So if there are particular ones that you want to direct me to, go right ahead.
There's no additional questions from what we had earlier. So I think we'll move on to Dr. Wu, and then we'll go through these questions in the chat. And again, people keep putting questions in there as we go, and we'll open it up.
Okay, so then I'll just finish then with flu vaccines, in addition to all the good masking, physical distancing, and hand washing. And then for seniors, it's really important to just keep your regular appointments with your medical providers. Don't put it off until until the pandemic is over, because it's going to be a while. And we're starting to see, where people are going to have undetected, for example, breast cancers and colon cancers for skipping mammograms and colonoscopies, and obviously the importance of the flu vaccine.
That's great advice, and probably a good segue to Dr. Wu, who's a family practice practitioner with Family Care Network. Dr. Wu, we would love to hear from you, and thanks so much for being here.
Sure, thanks for asking me. I'll first of all say that I completely agree with everything that's been said so far. So rather than repeat, I'll just try to add on a few things. My simple formula for thinking about controlling infection risk really revolves around 5 factors, right? So distance, time, so the amount of time you spend together, whether you're indoors or outdoors, which has to do with the volume of air and air circulation, whether or not people are masked, and then the specifics about how much are we projecting our breath. So singing, shouting, loud talking, all the projection messages that we tell people they should do when they're public speaking are exactly what we don't want to be doing in terms of contagiousness. So just, it's the sum of those 5 factors that determines most of your risk in a social setting. And so So the worst case scenario is a closely packed group of people in an indoor space for a long time, singing and talking loudly. And as much as you can mitigate that and move in the safe direction, I would encourage that. The other piece I want to talk about is the incredibly disproportionate effect that this pandemic has had on folks who are already most disadvantaged. So this is not an equal opportunity offending pandemic. The statistics are obvious, and I see this play out in my practice because, well, I was just talking with a woman earlier today who is a grandmother at higher risk, but has taken in children, grandchildren, even though the children are working and the children-in-law are working, markedly increasing her risk. She was quarantining by herself, but because of income and Wi-Fi connection considerations and kids needing to go to school, her circle of contact has now markedly expanded because she wants to make sure that her grandchildren are getting schooling. And that means that her household has expanded markedly and her risk is markedly increased. The two-income, no-kid computer programmer, financial analyst who can work from home is at very low risk and already had all these advantages to begin with. But the low-income family that is working, delivering food or at the grocery store or in food services often doesn't have a lot of choices. And so the income disparity is really marked. And the other thing that happens is that when you get COVID into a household, it's extremely difficult to prevent it from spreading to other members of the household because of the same factors that I mentioned earlier. Indoors, length of time together, distance, people don't tend to mask 24/7 in their own home. And so it becomes very difficult to control in-home contagion. Then there's the secondary fallout from that, which is that if you're isolated at home because you have a case of COVID in your household, every time another person gets sick, then everybody who hasn't been sick yet, their period of required isolation gets further set back another 2 weeks. And so you can lose tremendous amounts of income as the COVID gradually works through a household with multiple family members. And in low-income households, there tends to be less space, less ability to isolate, and more likelihood of contagion. So there's a special need for support in successful isolation as income level goes down and housing becomes less secure. And that's without even speaking to the homeless population. So that's the other thing I want to throw on there. I agree with everything else that's been said. I also, sort of tagging on to what Serge said about preventable, avoidable illnesses and the screenings and so on. I think those are very important. But the other thing is that there are a lot of acute illnesses that I think are either not getting treated or getting delayed in treatment because people are avoiding coming in. So for example, a person may think, I'm not going to go in because I think I might have COVID, but they actually have regular bacterial streptococcal pneumonia. Those people need to be seen and treated because we can cure them and that disease can kill them if they don't get treated. The person with abdominal pain who thinks it's COVID, but they've actually got gallbladder disease, regular care still needs to happen. And, I think the whole medical community has done what we can to make it safe to come in. But the other thing is that there is no way to make the risk zero. And I think we just have to accept that if we're going to function at all, we have to accept that we can mitigate risk, but we can't eliminate risk. But we have to keep functioning because, as Serge said, this is going to be a long time. And I think we should be thinking about a sustainable model if this takes a year or more, because it easily could. That's all I've got.
Thank you. And I think I'll go through the questions and I hope you'll chime in. Kind of related to what you were just saying, Dr. Wu, people are wondering, when is it safe to go back? And what we heard from Dr. Lindner is this could be going on for a year. Is there anything else that any of you would want to add about when is it safe to go back? And what we've just talked about is right now there is no safe. So how how do we look towards the future, and what are we preparing ourselves for in terms of eventually returning? What's the timeline look like?
I do not have an answer to that question, and I don't think anyone has an answer to that question. But I will say, I don't think we want to go back. I think we want to go forward. You know, where we came from when this pandemic started was not a good enough place to begin with. We were not prepared. We were not organized. We did not have good leadership. We had way too much social disparity. We don't want to go back. Back wasn't good. We don't want to go back to normal. We want to go forward to something better.
Thank you. One person asked, what do you recommend in terms of air filtration system in a church? And Dr. Chandranesan answered that an air filtration system will not help in preventing the spread of COVID within a congregation. Anything else that you'd want to add to that?
Yeah, I think like the air filtration system is, I mean, if someone has COVID within the congregation, you are going to get COVID if you don't maintain the distance, not wearing masks, shaking the hands. You know, those things are going to happen even if you have like an amazing, perfect air filtration system. The air filtration system, what it does is it helps like circulate the air in a certain specific pathway within a building. It is in general, it's helpful for having a more cleaner air. But if you have someone within 5 feet, within like next seat sitting with a COVID, and you had a good filtration system, that's not going to prevent it. Because I saw somewhere in the news, like apparently once, like someone claimed that there is an air filtration system that is going to remove COVID from the churches or something. So yeah, there is nothing that will help it. In the hospital, we have like a HEPA filtration system. Primarily, the HEPA filtration system is used so we don't get the environmental fungi and certain other pathogens from not getting, like people who have transplant, cancer, they're getting medications from chemotherapy, HIV patients, their immunity is low. We all breathe pathogens every day, but it does not bother us. But people who are immune compromised, when they breathe that, they have a chance of getting the infection. So that's why we have a very strong filtration system in the hospital. I don't know what filtration system they usually use in churches. I have a civil engineering background, so I would refrain from that. But I think in general, that is not the answer to preventing COVID.
Thank you. Tenda asked, are you seeing people get infected who do everything right? Wear masks, distance, wash hands. We see stories in the news about people who get infected at church, school, or gatherings, even outdoors, who aren't following the precautions. Just wondering if the recommended precautions are effective enough to feel comfortable doing some activity out of the home if you aren't at high risk.
Yeah, I answered the question on that. So I think like other speakers told, on a population level, like when we are talking about a high level whole community or population, I think like using masks, distancing, and hand washing are very important. I think that's the thing that's going to prevent you from COVID. But like we might see occasionally someone who are very compliant on all these three fronts, and they can still get COVID. That should not discourage us from following those three things, you know, because following those three things might have prevented 99 people from getting COVID, but one person got it. More likely than not, that person probably slipped up somewhere or the other, which they did not remember. And also you have to keep in mind, there are asymptomatic spreaders. There are asymptomatic patients who have COVID. So you might have met someone, or someone would have used a chair or any other fomite you might have come in contact with. So that is another possibility. So yeah, I think you're going to find someone, your relative, friend, who followed everything and still got COVID, but that should not discourage us from following those rules.
And you answered this in that chat too, but are you seeing kidney damage? And you said COVID could cause kidney damage on a critically ill patient where multiple organs are affected, like the heart, lungs, and kidneys, but it doesn't have COVID doesn't have a specific damage pattern just to the kidney. So that seems like we've got that covered. Here's another question. Those of us who are more advantaged, do we add to the danger to already disadvantaged folk if we choose to make more visits, go to the store more often? So maybe, and this is Sharon from First Congregational. I think this is, so you're asking if by helping, are you making things worse, I think. And if you want to clarify your question, feel free to unmute and chime in.
Yes, that's exactly what I'm asking, Amelia. Thank you. Dr. Wu had mentioned the folk who are more disadvantaged are the ones who are getting sick more often. And those of us who are not, I'm wondering, especially if we don't know that we're spreaders, if we're asymptomatic, you know, and gathering in small groups in faith communities or making visits and doing such things, are we then adding to that? Like I'm thinking, you know, if we have a mostly healthy population or advantaged population in our congregation, then them getting together, is that affecting others negatively? I don't know if that makes sense.
I can try to answer that, Sharon. I think, as with most things we think about in medicine, it's an analysis of risk versus benefit. And if there was no countervailing benefit, then you wouldn't get together. But I think the kinds of activities you're talking about where you're ministering to someone, there's definitely a benefit. And, you know, does it make sense to deny people all of that because there's a small chance that you would be an asymptomatic spreader and give them coronavirus despite the fact that you're washing your hands and, you know, wearing a mask? I don't think that makes sense. I mean, life has to go on. And as I said, we can't make the risk zero, but I think we can mitigate it substantially enough that I think it's reasonable to continue to tend to people, because without tending to people, things just are going to, all the wheels are going to come off, though, you know, societally. You know, this is a question that we have to look at in my work because, you know, I still see patients in person, and I recognize that for many people, I am the most risky person they will come in contact with because of the number of people that I see. And so, you know, I try to mitigate that risk by, you know, we clean everything around us, we wear masks, we do all of the appropriate things, but recognize that I can't make that risk zero for them. But if they need to get seen, that's the countervailing benefit that makes it justifiable. Conversely, when I'm not at work, I actually really try to limit my social contacts because I recognize for most people who might choose to see me socially, I'm also their highest risk person. And so I actually see very few people socially in person because of my work. You know, my wife is kind of stuck with me, but you know, the kids are out of the home. So really it's just my wife and I, and I'm, you know, when I go home, I go straight from the car to the laundry machine. I take off all my clothes, I put them in the laundry machine, and I go wash before I do anything else. So yeah, so there's as long as there's a countervailing benefit, I think you can justify doing the service that you need to do, as long as you're careful. One of my friends who's a critical care nurse at the hospital, you know, we don't hug people anymore, which is too bad, but one of his patients said, "Can I shake your hand?" And he said, "Yes, you can shake my hand because that's what hand sanitizer is for." And, you know, that patient who felt they needed that contact, and that's a way to mitigate that risk. It's all risk benefit.
Great. And so related to risk benefit, someone is asking about recommendations for people over 65 having family for Thanksgiving and Christmas.
I'm sorry, but I think that's a terrible idea. It's, you know, that's going to be really, I mean, it could be done, right? It could be done, but it's going to be really tough. You know, people want to be close over the holidays, and it's very difficult to resist that impulse to hug the person you haven't seen and may not see again for 6 months. But if a person really felt compelled, like, I mean, you know, let's say this was a person where you felt like this was likely to be their last holiday season. You know, there's a countervailing benefit. So if you really needed to do this, what we do when we actually do get together socially with people is we always do it outdoors. We don't, we try to have people bring their own food and beverage, or if we're serving, then we make sure that whoever's serving is masked, gloved, etc. And we don't go back and forth, and we sit really far apart. And yeah, that's what we do when we feel like we absolutely have to get together. Actually, my wife and I just bought an outdoor giant party pavilion tent so that we can actually socialize with people through the winter.
Anyone else want to chime in with their thoughts on that?
Yeah, I'm sorry to say I agree with Dr. Wu. It's going to be very tough to have a safe Thanksgiving, especially with the weather being, you know, not conducive at that time of year to sitting outside far apart. Just gathering in an enclosed space is just so much riskier. And then all the precautions that he described, I completely agree with if you are going to take that step. So it's hard to, very, very hard to do a Thanksgiving dinner safely.
Great, and then we've got a
just on that real quickly, I often use the phrase rather than physical distancing, or social distancing, I use physical distancing and socially connecting. So even though we're not going to be together and we shouldn't be together, especially mixing people who haven't been together in a family unit, there's still reach out and socially connect and look out for each other, especially those that may be alone or it may be new for them to not celebrate the holidays together. There's other ways to connect.
I'm really glad you said that. I think social distancing is a terrible term. Physical distancing is what we need.
Agreed. So a question about insurance. Do you foresee that telemedicine visits will continue to be compensated by insurance, the Centers for Medicaid, Medicare, etc.? Yeah, it's hard to know. I don't, if we had a insurance expert here. We'll try to get an answer to that question, but it doesn't sound like we have one.
We definitely don't have an answer. I will say it may be continued to be covered, but it will require people demanding it.
Okay, many of us, here's another question. Many of us have heard about church spreading events at churches that don't follow the recommendations, but have we seen failure scenarios where churches have contributed to the spread when they've been following all of the recommendations? It would be helpful to know about non-oblivious failure scenarios. And the context for this question is that because the state has allowed faith communities to gather, there are lots of denominational, lots of churches and congregations who have returned to worship, practicing those recommendations. Oops.
I will say, as somebody who listens to patients from many, many churches and congregations and synagogues, I hear tremendous success for the ones that are doing good social distancing, masking, where they have to sign up to attend in person, and there's rotations where no more than 20 or 25% of the space is being used and all that kind of stuff. The failures I've heard from those who are COVID patients are they attended churches where none of those were being followed, and we've had that here locally. But that's just anecdotal. So kudos to all of you who are doing such a good job in following the guidelines and keeping all of us safe, because it's not just keeping the church community safe. Those folks in the churches go to the stores and interact with everybody in the community. So you're keeping the community safe by just following the most basic guidelines. So thank you, thank you, thank you.
And I would echo those things. You know, successful public health efforts are never newsworthy because nothing happens when you're successful. And you know, the best outcome with preventive health is that nothing happens. So when you're doing everything right and nothing happens and it doesn't make the news, that's a good outcome.
And the patients who told me stories of their successful churches, they were in here for knee surgery and for other things, not for COVID. So it was the COVID patients who told me, oh yeah, my church, you know, we were all sitting together at a big party, and oh yeah. So anyway.
Yeah, it's a very stressful time for faith communities, and that's why I really think it's great to be together to talk about these issues, because there's so many daily and long-term decisions that are being made by the folks who lead their congregations. So I just want to acknowledge that difficulty. I've got a question about annual Thanksgiving baskets, where this congregation takes bags and boxes of food to those who are in need. Are there precautions we should be taking when we do this program? So dropping off the food and
I can take that one. I think actually the inobvious risk here is actually for the people who are assembling the baskets, because if they're working in close proximity to each other in kind of assembly line style, that would be your biggest risk there. The actual distribution of the baskets, it can be made very low risk. You know, you just want to wear gloves and keep your hands clean when you're assembling them. And then when you shouldn't have more than one person in a car, ideally, when you're driving these out, unless the people in the car are from the same household. And then when you drop them off, just don't hand them over, but put them down on the stoop and back up a few steps and say what you want to say while wearing a mask, and just keep your distance, and it should be fine.
Thank you. Anyone else want to say more about, it's an interesting time because for many faiths, we're moving into kind of a sacred part of the calendar out of the church year, the congregation year, when there are usually more gatherings and more singing than usual. So I'm guessing that questions about those annual traditions will continue to come up and be grappled with. Any other questions? If we have about 5 more minutes, and then we'll move on to kind of talking about next step and additional resources for faith communities.
I have a question for faith leaders. If no one else has a question, I'm just wondering how they're all doing in terms of the stresses of running a congregation under all of this, making payroll, and I mean, the stresses must be intense. So my heart's going out to y'all.
Thank you.
Maybe we can do a whole session on that, a little stress management session or mini retreat or something.
Yes.
I have a question. Oh, sorry.
Great.
I have a question. When I'm down in Thurston County, and it looked like we were going to go into phase 3 in July. So we were meeting and talking about things. And one of the big issues was cleaning the surfaces of the church between services. In other words, we have an 8 o'clock and a 10:30, and how were we going to make sure that everything was really clean? Now it looks like surface cleaning, if you're doing everything else, if you're masking, you've got the physical distancing, you're hand washing, and you're not singing, that concern isn't as big as we thought it was going to be. And I'm wondering if the docs could help me with that, because I'm going to be the person who has to deal with that.
Dr. Chandranesan, would you want to answer that about surface?
So I didn't get the question clearly. So between services, they are doing surface cleaning, and what's the question?
Previously, there was a focus on that, especially at the beginning of the pandemic, and it seems like it's not as much of a focus. So how much time should they be devoting to that? How much energy should they be putting into cleaning every surface between?
Oh, they should definitely be putting effort into cleaning between the services, because I think we talked about before, I think one of the most important ways of COVID can spread is through fomites, meaning any high contact surfaces. So if someone, even though they might be wearing a mask and physical distancing, and they are coughing and they're like holding their hands in the face with the mask, their fingers and could be like have a lot of viral particles, and they have their fingers on the chair where they're sitting, chair handles and their seats and whatnot. So the next service person, when they come and sit down, they could easily get it, COVID from the previous person. So I think it's very critical. They do the like cleaning up of the high touch areas, not just the place they sit, but also like the door handles, like hopefully whatever entry points they have in the churches, all the high touch surface areas have to be like regularly cleaned.
Can I say something? At our church, first we gave out for each person that came in a little baggie with a cleaning cloth in it, and you cleaned it. And the doors are open. We really follow pretty strict protocol. Now they have just one of the cleaning plastic things on the pew, and people take it up and clean all the surfaces before they leave.
Okay. Yeah, I think I like that, but at the same time, I'm kind of a little worried if you leave it up to each person to clean it, would that be done in a more consistent way, I guess. For example, again, I'm giving my experience from a hospital or a clinic setting. But we have like people who we have trained and given some knowledge on how to do it, and they're more consistent at it, so they get more experiences. So I mean, I don't know how your hospital resources can like accommodate someone or a group of people who can like be more familiar with how to get it done, so that will be more consistent, I guess.
Okay, we've got some more questions in the chat. So what about advising families with children and teens who want to do small scale social activities with friends, including sleepovers? Great question.
Yeah, that would not be advisable. Yeah, I think that again, like, sleepover is like, yeah, that'd be like a high risk contact, I guess. And then I assume it will be like outside your family, friends and whatnot. Yeah, that would not be advisable.
Seems like, again, it's bringing up that time that Dr. Wu mentioned. How long are you in contact with people? And a sleepover would be longer. Here's another question. What is your take on the church gatherings where people are wearing masks? Is it okay to take the mask off when sitting in church for messages and put them back on when ready to leave the church and be dismissed? I guess that's kind of what we've seen in restaurants, so that makes sense. That's a great question.
Yeah, that's a great question. I think in restaurant, because we are eating and drinking, it would be a great excuse to remove the mask. But yeah, I think the hole in that problem in way of doing that would be if you remove the mask and you're sitting. I assume the sermon is like 45 minutes to an hour, and during the time, if someone has a cough, you don't have a mask to prevent the droplets from going out of your mouth. Sure, you can cover your mouth with the elbow or hand, but at the same time, then if you do that, then your elbow is touching your chair again, and the chair probably gets contaminated with viral particles. So Yeah, it's tough. It's tough. I understand like sitting, but you got to keep in mind, like we working in the medical field, we wear masks like 8 to 10 hours a day. So I think if you guys could accommodate an hour and a half, that would be really appreciated.
Great, just a few more questions and then we'll move to the next part. Our faith, this is for John, I believe, are faith community nurses allowed to visit a patient in the hospital if the pastor is out of town? So could be a faith community nurse or other designee, someone who's not the leader of that congregation. Can they designate someone to visit in their place?
Yeah, so a patient or family member can designate whoever they want to visit on a particular day, is my understanding. And if there's any issues around that, go ahead and contact me or my office. And I put my phone number in earlier in the chat.
Great. Someone wants to know, how will COVID impact Halloween?
It's a whole different sense of wearing a mask. Kids in their Halloween masks.
We don't celebrate Halloween at my faith community, but maybe this is.
I don't think the dentists see a countervailing benefit in Halloween.
Yeah, it's kind of becoming the season when we have a lot of events, harvest festivals, Halloween, Thanksgiving. So any other comments about events and how this will impact them? No, okay. Oh, and someone says yesterday the CDC recommended no trick-or-treating. Okay. I think we'll move on. I'm gonna bring up slides. Thank you so much to our speakers for sharing everything that you know that we might not know about this ever-changing situation and crisis. So now Allison Williams, I think that's right. I'd love to hear from you.
Yes, great. Thank you so much. I'm just thrilled to see so many people show up today for this gathering, and thank you so much to our speakers. That was a lot of information that you've shared and a lot of thoughtful questions. My name's Allison Williams. I have worked for the Whatcom County Health Department for many, many years. And I've worked directly supporting children and families, and for the last 5 years worked with a lot of different partner organizations throughout our community to build a better system of care and support for children and families. And I look forward to getting back to that work. I've been temporarily assigned to our Unified Command Joint Information Center since March. And am working with our communications team. And I just want to start out by acknowledging how emotionally difficult it has, the public health interventions that we're asking people to adhere to are really, really difficult. It's not easy. Public health has a lot of interventions that we have rolled out over the years, including hand washing campaigns and seat belts and things like that. But those behaviors get easier the longer you do them. And some of the interventions that we're asking people to do during this pandemic, like remain physically distant from those people that we love, is really hard. And it does not get easier the longer we do it. And a recent survey throughout Whatcom County, primarily to get data on COVID prevention behaviors for young adults, but it surveyed 4,500 residents across Whatcom County. We learned that almost all of us are doing a great job adopting preventive behaviors in public areas, and we struggle with keeping it up in private areas with family and friends for different reasons, and it depends, you know, the age group. Different age groups have different reasons for struggling with those, adhering to those interventions. But we are seeing in Whatcom County, our cases are trending up again after trending really down. We got down to, I think at one point, 30 cases per 100,000, and we're back up to over 48 cases per 100,000 now. So our cases have been trending up for the last few weeks, which is unlike many counties in Washington that have been trending down. And a lot of that is being driven by our behaviors in our private lives. And I just want to acknowledge that it's hard. It's really, really hard what we're asking folks to do. The first couple of decades, like I said, I worked in public health. I worked directly with families, and I heard from families that when times were hard, who they turned to for good, reliable information were their healthcare providers, and turned for information to their faith communities for information and support. So I think Amelia and I tried to blend those trusted advisors today with through the healthcare community and through faith leaders to talk about how we might work together to support developing messages that resonate with your congregations. And in working with the Joint Information Center, we know that our community is very broad. One message is not going to fit all, and I am sure that's true of your congregations. The message you may give to older adults will look different than what you're sharing with families or sharing with teens. But we're really interested in helping and working together to develop some messages that help our community stay safe and healthy, that resonate with your communities. We're thinking that you could drop answers into the chat to these questions, and I wanted to start out with the first question was, given all we've just heard from our subject matter experts, how do you think you might use the information that you've heard within your congregation? Does it change what you're sharing? Does it complement what you're already doing? And if folks want to just type into the chat some ideas, or unmute yourself and share ideas. If we have a lot of people talking, we may need to use the raise your hand function, which if you click on the participants, I think you have a little blue raise your hand that you could if we have a lot of people talking. But I'm curious what people, after what you've just heard, if you have ideas about how you might share this information with people in your communities.
Well, this is Carol speaking, and in the First Congregational Church, Sharon Benton, Reverend Sharon Benton, is also on this call, so she can chime in. But I think we've been very consistent with the church council giving us direction and sharing that information with the people in Zoom calls like this, and then getting their feedback. That seems to work pretty well for us, and it's pretty consistent approval of what we're doing, which is to stay closed until such time it's safe to reopen.
I'll just add, I've really appreciated this today, and I've even made a note of, I want to announce in the announcements during our pre-recorded worship service for Sundays some of what I heard today, because I do think there are still questions and conflicting messages. I'm really glad to be focusing on Whatcom County and specifically having PeaceHealth have a voice in this. So I really do appreciate this today. This has been very helpful.
Well, I'm down here in Thurston County, and I agree. I think I was just thinking that one of the things I should do is, I think the 25th of September is when articles are due for our monthly newsletter. And I'm thinking that I might write something, a short something about what is important, what people need to do, including the flu vaccine. You know, besides the physical distancing, the mask, the hand washing, and stay home, stay safe, that the flu vaccine and the preventive care. Just as a reminder to everybody that those are the important things. We're closed. I have no idea when we'll be open.
I'm looking over in the chat here. Yes, some of the messaging saying, emphasizing that the precautions are a way of showing love for others in the church and in the community. And let's see. I'm curious, I was curious as people were talking, are there, so I asked about how you might share information from your organization to your congregation. Are there peer-to-peer groups between leadership within the faith communities? Some of you may have participated in the Employer Support Task Force that's more on the organizational, the running end of the business, but are there peer-to-peer conversations about communicating to congregants?
We've pretty much done phone. We have a small congregation and they're mostly elderly. And so we've done most of ours by phone call, but we do send out, our president of our congregation sends out like about weekly updates, like what's going on at Hope. And so that's been very helpful, I think, to everybody. Our pastor is retired, so we're now in the midst of everything. We don't have a pastor also, so a challenge. And I think we just recently, just before a pastor retired, she tried to visit somebody in the nursing home and they didn't think she was actively dying, so she wasn't allowed to visit her, and then she passed away anyways. So that was very upsetting to a lot of people.
Mm-hmm. Has anyone found a particular way of communicating? You've shared, I'm hearing through monthly newsletters and emails and pre-recorded announcements and phone calls. Has there been any particular one message that you thought really, wow, we just hit the nail on the head, that really resonated with folks that we're talking to?
Allison, I'm not sure how to get on here. Can you hear me? This is Margaret.
Yes, I can hear you.
Okay. Let's see, do I mute or unmute?
You're unmuted.
I'm unmuted.
Yeah, we can hear you.
I want to just, I'm in a rather odd situation, having just retired as a school nurse, and my husband has just retired as the pastor of Northwood Alliance Church in Blaine. And we're trying to be careful as the transition moves. But so I'm trying to think of my role still going into church. And we had our first indoor meeting Sunday, and I thought it really exemplified what our doctors had said, and I so appreciated their comments. I love this idea of the team of professional healthcare people, our community public health people and doctors teaming with those of us who are in congregations as health professionals. So I felt like one thing I wanted to do was affirm to our interim pastor that those basics of the physical distancing, the hand hygiene, the masks that we're wearing, and I'll tell you, it was awful to keep my mask on in church. I couldn't breathe, and it was uncomfortable, and it was a long service, but everybody was masked. And I felt that I feel like for our congregation, the many that weren't there, a repeating and a validating of the guidelines we were given today is just really important as people begin to get sort of COVID fatigued and let barriers down and want to make exceptions. I just felt like somehow, and I think by email, just highlighting to the congregation via our church secretary some of these really important points that were made. So dispassionately, maybe some passion, because we need some passion on it, but we're in this for the long haul, and we have so many vulnerable members and many who aren't coming. So I'm just kind of talking, but it's a gratitude, and I want to take some specifics onto the congregation, and I think I will do it via email through our interim pastor and our secretary.
Great, thank you. Thank you so much.
Thank you.
I'm cognizant of the time here because we also have another health department. I have a health department colleague, Ann Beck, who's acting as the liaison officer for Unified Command, and she convenes a monthly meeting of community organizations and faith organizations. So I want to give her time to speak, but I am seeing in the chat that people are wanting more networking time to share this sort of information. So that's something that we can work on. And I do see one question about how close are we to moving to phase 3. And unfortunately, at the moment, we're moving in the wrong direction to get to phase 3. So I don't have a crystal ball to know when phase 3 might be coming up, but at the moment, we're not heading that way.
And we don't, this is my personal opinion, non-expert here, but I think we were all pretty adherent to all these restrictions over the summer, and infections went down. But as Ramona has mentioned in here, we're all getting fatigue with adhering to these restrictions. And so unfortunately, I don't think that we're going to move to phase 3 for a very long time, maybe another year. Maybe we won't ever move to phase 3 because we worked really hard and did that over the summer, and now people are kind of tired of it and are non-compliant, and that doesn't bode well for actually reducing the infections that need to happen before we can do phase 3. And I'm only saying this as a non-expert because in my faith community, it's been, there's been these moments where we've kind of realized that, and it's been totally changed how we made decisions and how we looked ahead and our reopening plan, because you might not reopen or regather until next spring or next summer. That's way different than if it's going to happen next week. So just a private citizen thought.
Yeah.
But we should move on to Ann Beck. Allison, do you have any?
Yes.
Hi, everybody.
Yes.
Oh. Do you need anything else, Allison, or can I jump in here?
Yeah, go ahead. I just want to thank everyone for their comments, and some of you may have gotten an email from me. I have a pretty big list that I also shared this information about this webinar, and Amelia and I will send out notes, and she can wrap up at the very end, but yes, we'll follow up. So yeah, welcome, Ann.
Thanks, Allison. Hi, everybody. My name is Ann Beck. I'm the job I signed up for at the health department was a human services supervisor. So I would oversee veterans programming, homeless housing program, programming for the county, and developmental disability programming for the county. However, then we had a pandemic hit. So I'm a social worker by training, and now I do whatever is needed kind of thing. But one of my favorite things is to come together with people, which is part of why I was moved into a liaison role for Whatcom Unified Command. And I've been working in the nonprofit field here in Whatcom County for quite a while. So I've kind of been helping to try to bridge some of those connections in the nonprofit world as well. So one of the things, I have two brief things I want to tell you about and invite you to be a part of. And then I'm also hearing in this conversation a need to maybe build more of a peer network. And I think that I'm happy to help with that in some way. I'll connect with Allison and others to figure out the best way I can help get that going, but I'm happy to help facilitate if need be in that situation. But I don't know, Amelia, do you have the slide by any chance that I sent you that you could share with everybody, just so I can remember to
just a second.
point out the thing. I just had 2 points I wanted to make. The first one was that I have a monthly meeting that I do with community and faith-based providers. This started when when COVID was first hitting our community in March. There were a lot of questions that a lot of our nonprofits and others that do ground level work with people had, questions about interacting and touching items and what it looked like. So we tried to have a weekly meeting with health department staff, with nurses, whoever it was that could answer some of those questions. And from there, that meeting has kind of evolved a little bit over time. And now we only have it once a month. There's a lot less questions because we've kind of hit this status of, we kind of know what's coming a little bit more. So we have a monthly meeting on the third Friday of the month. During this time, I'm usually discussing the services and activities that are in the community related to food delivery services, showers for people who are experiencing homelessness, and kind of other things that might be helpful for people in the community who might not have as many advantages or need to know where the resources are. And I'm happy to, I have a long invite list. It's just a calendar invite I sent out. I'm happy to send that to any of you if you want. That's my email address right there as a contact. You can send me an email and I'll add you to that meeting. You come if you can, and it's all via a virtual meeting. So, no in person at this point, but during that time, you can hear the bits I have to say. It's scheduled from 2 to 2:45. It's honestly, with the way things have been, it's been more like a 20-minute meeting, but it gives you a chance, if you have questions or if things come up and you want to talk to somebody, I can try to find the right answers for you. So that meeting is happening. It's mostly nonprofit providers, but occasionally we have some of our faith-based providers that join us as well. And then the other thing is, I was hoping you could get the word out. There's rental and mortgage assistance available in our community right now. Part of our CARES dollars we've set aside to be able to help folks who are behind in rent and mortgage due to a loss of income because of COVID. And so there's a flyer there that I screenshotted. I have an actual flyer that I can send out to you as well. If you want to, I can either send it to Amelia and she can send it out to everybody, or if you want, you can email me and I can get it to you. But please share that. And we're also having it translated into Spanish and Russian as well. But there's money available to help people that are between 50 and 80% AMI is what our CARES dollars are focused on. And then the Opportunity Council is helping folks with an area of median income of less than 50%. And those incomes are on the flyer so you can see. But Law Advocates, Salvation Army, and Opportunity Council are all doing virtual appointments with folks, gathering the information and then submitting the requests. And we can help with up to 3 months of mortgage or rental assistance for folks. So it's a great resource. We want to keep people housed. We know we're in this for the long haul. The last thing, we want people worried about is losing their home as well. So we lean into you all to help get the word out to people in your congregation who might be struggling, who've lost their income due to COVID. And I think that was about all I had. I'm happy to, you have my email address there. If things come up along the way and it's not even my job to find it, I will still reach out and try to find it for you. I think the key to getting through this is for all of us to feel a little bit more connected and to feel like we're able to get the answers we need. There's nothing worse than just kind of the unknown. And I think so much of what COVID has been for so long, at least for me, has been like, I don't know. So let's figure out how to not have so much unknown in our world. Also, I'm going to just say this as a social worker, make sure and talk to people and tell them how you're feeling. I know professionally, I'm always cautious about, I get scared about telling people how I'm really feeling, but this is really hard. And I've been, we've all been doing this for a long time, and we're all carrying heavy loads in our personal life, in our careers, in our relationships. And we're doing this in a world that is not normal right now. And so it's a heavy load. And I know I feel better when I know other people are honest about that for themselves, because we all can kind of lean into each other when we can and ride the wave. I always tell people, today I'm okay, yesterday not, and I don't know what tomorrow will bring. So just hang in there, talk to each other, and then reach out to me if you need anything.
Wonderful. Thank you, Anne. Thank you, Allison, my partner in crime, for this event. You were so helpful getting those fantastic speakers. I'm just so grateful that you all, each of you, were here. And I'm going to put up Allison and I's contact info, so you have it. You've gotten emails from us, so I'm guessing you have it, but just in case. Here's our contact info. You can take a screenshot or take a photo. And yeah, thank you so much for being here. If we could all do an applause for all the speakers and all the people who made this possible. Thank you so much. And I love the idea of convening this more, so I'm happy to support that. And as Anne said, take care.
Is this going to be available to be viewed later?
Yes, great question. The only problem is I started recording about 15 minutes in, but yes, most of it is recorded. So I'm going to send that out in our newsletter. If you don't get our newsletter, we'll also send it out to the general list, but you should receive it. Great, and I can keep this on if people want to connect with each other, because we can't, if we were in person, you could have your own breakout rooms. So feel free to chat a little bit. If you want to do a breakout room, you can put that in the chat, and I can do that. Allison has posted a handy resource flyer link in the chat, and thank you very much. I'm not hearing very much conversation, so I'm going to end the meeting. Thanks, everyone.
Thank you, Amelia.